Good evening. Namaskar, good evening, Assalamu alaikum. And today is 24th July 2024. We welcome you for the 30th Outreach and Knowledge Transfer OKT webinar. And we have a very important topic today, which is imposter syndrome. Do I have it? So that's very interesting topic today. As you see on the top right corner of the image, imposter syndrome, that's what we are going to talk today. And we have posted a small quiz link there, which is a pre-session survey through a CLANS imposter syndrome self-assessment tool, which will really talk about your own self. There are simple 10 quiz questions, which our doctor is going to briefly elaborate on that. So with that, we would like to briefly talk about our meeting protocols, which is kindly mute your microphone and only speak whenever is required. Switch off your camera and switch on whenever you want to speak. Kindly post your queries and some comments and suggestions in the chat box. And there is a WhatsApp group, a QR code, which is on the screen. You can just click the QR code and join our WhatsApp group link, which is very active with 470 plus members sharing from different parts of the world around the clock on different subjects. With that, I would like to briefly inform you that today's agenda is going to be in two parts. The part one will be talking about the J&A Bharat as well as Global HSC Foundations. And part two will be the very important topic today, imposter syndrome. Do I have it? Most importantly, we are connecting that syndrome with the impact on the workplace safety, as we are a safety professionals today. And I would like to introduce our founding trustee, fellow founding trustee, Mr. Jitu Patel. He is currently attending from Arizona, USA, and he is part of the ASSP for more than 50 plus years. And he was instrumental in establishing ASSP Saudi Arabia chapter in 1981 and continuing his support to the HSC profession, even though he's very active now, even though he's retired quite some time back, but very active, more than the working people. Jitu Saab, please go ahead.
Thank you, Ashok ji. I would like to welcome you all very warmly, and starting with respected honored guests. First of all, Dr. Varsha Reddy from London, who is our keynote guest speaker, Professor Ramana Garuji, Dr. Lakshmi Narayan Garuji, Mr. Ram Prasad Garuji, our honored guest, Dr. Jaina Clark, who also has won the Presidential Award and in distinguished teaching, and all the dignitaries, educators, professional leaders, and distinguished delegates. On behalf of J&A Bharat, as well as J&A Global HSC Foundations, a very warm welcome from Ashok ji and myself as two co-founding trustees. Everyone knows my very dear and great friend, who is also co-founding trustee, Ashok ji, for his remarkable contributions to the HSC profession, who has also developed countless number of HSC professionals globally. I'm proud to share that Ashok ji has been serving as the president of Board of Certified Safety Professionals effective from past January 1st, 2024, and doing a phenomenal job. Many of you must have gone through his 2 quarterly reports, and they really indicate how profound and how professional leader he is for our profession. Without going into much detail, we are proud to also say that he is the fellow of not only American Society of Safety Professionals, but also AFIH, and many more feathers he has on his crown. With that, Ashok ji, it would be nice if you can take over and give a brief about our foundations, please.
Thank you, Jit sir, for that quick introduction. And yes, of course, This is our 30th OKT session. Many people are aware of our foundation, but there are few people who joined our foundation first time. For their benefit, we just want to introduce about our foundations quickly in 5 minutes. As you see on the screen, there's a world map with the little blue flags. These are the places, these are the countries where Mr. Jeetu Patel and myself have supported for the HSC profession through different organizations. And we wanted to do something more for India. As you see on the screen on the left side, there is a global deaths related to the industrial accidents. And unfortunately, India is continuing to be on the higher side, on the leading the map. But there are so many activities are going on, so many professional organizations are there, so many government rules are there in India. Still, we wanted to support our Indian friends through our foundation activities. With that concept, we established this foundation on 25th March 2022. Again, during the peak of the COVID time, it was established virtually. And our intention is very, very simple. It's not a membership organization. It's a purely charity-oriented organization. We collaborate with the professional organizations, corporate organizations, academic institutions, and individuals. Again, today is our subject matter expert. The speaker of the day also is from one of the institutions, premier institutions in UK. And our mission, vision, and objectives are very simple, just to support the profession, health, safety, and environment profession, as well as the health, safety, and environmental professionals. So we mainly aim in advancing the occupational safety and health profession, to support and promote occupational safety, health as a career, to inspire and develop the leaders in health and health, safety, environment field, to provide education and developmental opportunities, as well as recognizing individuals. We are introducing several recognition programs who are really doing great. Also, we conduct, like today's OKT session is one of the knowledge sharing session. We also do some sort of a training programs and community outreach programs. We also have the MOUs, which is a memorandum of understanding with the having the organizations having the similar objectives, and we are officially registered in India. We do have our websites in place, and we have 3 programs in place, and 4th program we are launching today, which is one is a professional development grant, another one is the industrial accident victim family support grant, and this is the 3rd program which we launched on the 2022. Basically, it is a scholarship program. We call it as a J&A Keval Shanti Scholarship Program. We have a student mentorship chair, Mr. Professor Ramana, who is handling this particular program successfully from last 2 years, and soon this year we'll be announcing. And these are the winners for the 2023. And we have another DL Shah Trust program as well, recognizing the individuals who have successfully supported the HSC profession. And we have a website. If anybody wants to support our foundation, there is a website, expression of interest form. Kindly go there and express your interest. And we have a governance body in place. We have the functional committee chairs are in place. So these are the people who are really supporting voluntarily to our foundation. And that was initially started with the Bharat, and we expanded our wings to the global. So that was, again, the Global HSC Foundation was started on 30th November 2022. And we do have several programs in place. I'll be briefing other programs after our part 2, which is knowledge transfer session. Every month we do it, and this is the 30th session. So as I said, that's last 2 years onwards, we are successfully conducting these sessions. We would like to thank everybody who is joining and who is also supporting us, sharing this knowledge through these foundations. So there are so many all recorded sessions are available in our YouTube channel as well. So with that, we would like to start our part 2 of the today's topic session on the imposter syndrome. Do I have it? Again, I'm just requesting you that the quiz link or the quiz link has been posted, basically talking about the 10 symptoms of the imposter syndrome. Please take your time to fill those quiz pro questions as well. And it was also shared earlier also. So Dr. Varsha is having enough information about our participants today. Before we hand over to the Dr. Varsha of today's speaker, I would like to request Mr. Ram Prasad ji, who is our chair, functional committee chair for the partnership and synergy development. He has been instrumental in establishing MOUs with the Safety Engineers Association, Center for HSC, Andhra Pradesh, and continuously supporting our organization. So, Mr. Ramprasad, kindly take your time to introduce our today's topic as well as the speaker.
Good evening, Namaskar. It's a pleasure and honor to be here. And to be very frank, this topic was very intriguing. Imposter syndrome. Let me confess, I went to Google and tried to find out. And this is one subject that is very intriguing. Therefore, I will not try to go deep into it on a subject which I have no knowledge. Would rather leave it to our subject matter expert here, Dr. Varsha Reddy, to explain and speak to us about it. Dr. Varsha Reddy is a practicing senior doctor, geriatric specialist at the in Lancashire.Lancaster, United Kingdom. She completed her postgraduate diploma in Bioethics and Health in 2021. And to top it, she completed law in medical and health sciences. Having studied in UK, she is aware about the liability issues that can happen in her profession. Good thought, Dr. Varsha. And in 2019, Associate Fellowship of Industrial Health. Doctor of Medicine, Geriatrics, MGM College, Navi Mumbai. She also completed diploma in Chemical Cosmetology in 2014. Her 2014 postgraduate fellowship in Aesthetic Medicine, MBBS in 2005 at MIMSR, Medical College, Latur, Maharashtra. And Dr. Varsha's experience also includes as a medical advisor, TST Technologies, Bengaluru, Assistant Professor, Medical Advisor, SDU MG, Kolar Faculty, Yenepoya Hospital, Mangaluru, Assistant Professor, Geriatric Medicine, MGM Hospital and Medical College, Mumbai, a senior resident at MGM Medical College and Hospital, Navi Mumbai, observer, Heartlands Hospital, Birmingham as an observer, George Eliot Hospital, Newton internship student, MIMSR Medical College and Hospital. Therefore, she comes with a very rich and varied experience across India, across UK, and to top it, she has got a legal knowledge in they completed law in medicine and health sciences, which is some subject dear to my heart. With these few words of introduction, let me hand it over to Dr. Varsha to take it forward. A very warm welcome, Dr. Varsha. And we are looking forward to hear from you on this very intriguing and interesting subject. Over to you, Dr. Varsha.
Thank you very much. Coming to the topic of, thanks for the kind introduction. It was quite a wide introduction starting from my graduation to post-graduation. I felt like I have gone back to my entire history and entire life, to be honest, with your
Dr. Varsha ji, just would like to, Mr. Jeetu would like to say a few words before you continued. Mr. Jeetu.
Thank you, Ashok ji, and I apologize the interruption, Varsha ji and
No
Arpi
problem.
Guru ji. All I wanted to share is that we are so honored, as our RP Guruji already mentioned, you were introduced to us, our foundation, and personally to me by everybody's great friend and a great mentor, Venki ji, who was the person who inaugurated this J&A Bharat HSC Foundation 2.5 years ago. So we are so blessed with his advocacy, introducing such a distinguished, young, dynamic person to our foundation as a great speaker. Thank you, Ashok ji. Thank you, Varsha ji. Thank you, RP ji.
Thank you very much. So there are good news and bad news always, right? So the good news is I'm continuing my session, and the bad news is I haven't got my presentation to share with you because I rushed from the hospital last minute and I just couldn't fetch everything on the platform to share my PPT with you guys. But I won't disappoint you. Let's go through the old school way and understand. If I can see all the participants on the screen with their videos on, I'll be really very great.
That's good. Yeah.
So I don't have to share my PowerPoint, so we all can see each other.
Yeah. I'll put you on the spotlight so that they can see you clearly.
Oh, that's absolutely not required, but that's fine. No problem.
Yeah. That's great, ma'am. Yes, go ahead. Yeah.
Yes. So going ahead, good evening. Thank you very much. I'm very pleased to have this opportunity to share my experience and what exactly imposter syndrome means and why it is so important for all of us to understand what is imposter syndrome. Because, you know, it is like something we all go through, but it comes with a fancy name. And then we try to understand it in a more better way. So that is something I feel about imposter syndrome as well, that it is there with all of us for a long time. We are going through the journey, but we haven't highlighted or we haven't had an insight about it unless it came with the fancy name. So the today's topic would be unmasking the imposter syndrome within the industrial workers, because we are going to talk to most of us who are here, apart from me, I think, are all exposed to health and safety and have been exposed to the industrial healthcare working environment. So this imposter syndrome is what exactly, because we have all gone through the questionnaire, would anybody would like to tell me what exactly imposter syndrome means to them at this level of understanding? So let's make it a little interactive, so we understand it step by step. And then if you share me anything what you felt, so I could share my experience and try to give you a solution to overcome that. So that would be like a proper learning pathway for us, rather than going through a theory and then understand it. It's not an exam. So let's try to make it simplified manner.
Yeah.
Okay, I will take the first hit.
Yes, please.
Most of us here are professionals and qualified people.
Yes.
But at the same time, there's a lot of hesitation in decision making, especially critical decision making, where you become hesitant, you become nervous inside your own self, saying, are you competent to take such kind of a decision? Is, I think, what I understand by imposter syndrome.
So exactly that is what imposter very well said. I mean, I can't see who was speaking there, but whoever has said, I really appreciate. That is what exactly imposter syndrome means. But imposter syndrome specifies with a different personalities in a different way and a different environment and a situation. So so let's start with an example. So if you take an example, some very pretty, beautiful lady is crossing by and she knows she's looking very beautiful, she's very pretty, but you go and say her, wow, XYZ, like let's say Pushpa, you're looking so beautiful today in this attire. She herself within her heart knows she's looking really very beautiful. She has put maybe 10 hours of effort to get that costume, get herself look like that, to present herself in that particular function in that particular way. But then if she is like, oh, okay, really? Is that so? Is the dress is looking that nice? Oh, okay. I don't think so. So this is exactly what imposter syndrome is. Now, what do you think here the problem is, Ram Prasad ji? What do you think? What was the problem here now?
It's a matter of self-confidence.
It's a matter of self-confidence. Yes, it is. But
and a doubt within oneself, because you go about your activity in a normal way. But
yes.
The moment somebody passes a remark, you end up being in a self-doubt.
Yes. So the self-doubt and having, I won't say she didn't have a confidence, because if she didn't have a confidence, she would have not been present at that particular event.
So the question puts her off. The question puts her off.
Yeah. So the self-doubting initiates, there is a trigger. So we understand there is some.
The question is the trigger. The question is the trigger.
Yeah. So there is certain triggering factors. So as we unmask this step by step, what imposter syndrome means and how we are going to go, I would explain you why and how it is. So everybody has imposter syndrome within themselves. There is not a single person on this planet, if I'm not exaggerating, has imposter syndrome within them. The only difference is some people know how to live with it, some people know how to overcome it, and some people doesn't have a insight within themselves that they have an imposter syndrome, and they just carry on throughout their life. So multiple factors contribute, as I said, like starting with the childhood. If we call our kid, you are the smartest kid in the class, you are the smartest kid, you are my smartest boy, you are my smartest kid, you can do this, you can. So you have already imposed the syndrome within him, because you have marked a scale for him, and below that scale anything is not acceptable for that particular person. And when that particular thing is not able to be accepted by the person, that is where the problem starts of self-doubting. So if I get 90% throughout my life, and in medicine I get 70%, I am not happy with myself. Though the world might be celebrating, oh wow, she got 70%, but I might not be happy within myself. It is very much seen in the professions like healthcare professionals have, because there is a competition. So where the competition comes, that is where the imposter syndrome as well comes. So this is one of the things. Then your personality triads as well makes a difference. So it's a big workshop actually, imposter syndrome. I'm trying to constrict it in 45 minutes. So the personality triads come according to the alpha personality. Some people will have a very high kind of a scale, and they are very outspoken. And depending upon the zone, red, fairy, green, orange, and a kind of a yellow. So these are the 4 colors and different personality triads. So depending upon the personality triads as well, the imposter syndrome affects on individual people. Then as we already, I mentioned you about the upbringing, how you give the upbringing to your kids. Is there, if they have a failure, do you accept it as a part and parcel of life, or you make them more competent? Oh, you have failed this time, come on, you are going to do better next time, and you are going to do this, and or you're going to say that person that you did 100% best yours, and this is what your result was. Now this time maybe you need to have some better, more, you won't say that you need more effort, or maybe you can try it in some different way to achieve the same goal. So the wording makes a lot of difference in imposter syndrome and impacting on an individual. So that is when it comes to the industrial health people as well. Most of the people who are working in the industrial health, they are working in a cage. I won't say cage, but it is like an industry, right? It is in the 4 walls of the industry. So most of the time it is not seen by the outer world. Though the product might be so fascinated, it might be some celebrity showing that product, but the effort is done by the industrial workers. But the appreciation is not getting to the root people who are really putting that effort. The appreciation is getting, maybe Deepika Padukone is doing an advertisement, she is getting that appreciation for that particular product. So that is where the imposter syndrome and appreciation, lack of appreciation, is seen in the industrial workers within themselves. So that is where they start self-doubting themselves as well. And they might not be elaborative because they are within the compact walls. So that environmental factor also matters. The appreciation also matters when it comes to the particular sector. That is where the work environment and the appreciation of an individual workers does make a difference. So how do we unmask this? So to unmask anything, we need to know the symptoms. We need to understand what exactly how the person can behave, or how the person is going to act particularly, right? So common imposter symptoms, like you feel like, oh, I am a fraud. I have got this post. I am presenting this because Venki ji has introduced me, and that is why I have got a global platform to present my presentation out here, or else I would have never ever got that chance to do the presentation. I might be very good at my presentation, but that self-doubting is imposter syndrome, and that will be somewhere back of my subconscious mind, to be honest, or everybody and anybody will get through transition phase, but that phase or that thought is not staying with me for longer time, because I'm not suffering from that syndrome. But definitely, as I said, it is a transition phase. It will just, the thought comes to my mind and it's passed on, and I have gone through that particular phase. So that is one. Feeling that you are not ready. So like giving my own example now, even if my presentation might be perfectly all right, I might not be able to good enough to show it to you guys, thinking that no, it is not yet ready, my presentation, to show all these guys, because it is not up to the mark of my presentation styles. So I'm just giving you the present and live example, what an imposter syndrome and the outcomes can be. So that self-doubting and that not giving that presentation is because I am not feeling that that is still up to that mark. I hope you are understanding, or I'm making it more complicated.
No, it's yeah, easily understandable. Yes, yes.
Okay. So a lot of time people are feeling that they are not ready or they are not worthy. If somebody has gotten promotion, they feel, no, I got this promotion just by luck. I wasn't that great, or I haven't done something. Maybe it was a teamwork, but because I was sitting in front, I got the promotion. So that can be one of the things which most of the people have the self-doubt. So suffering from self-doubt, self-criticism, and self-judgment, these all things are very unhealthy kind of a thing. So how to take it when somebody appreciates you, or somebody is giving you a compliment, that comes in our further unmasking preventive measures. So belittling or downplaying, like even if you are very good at doing something, you might just be backseated. Lot of times we have seen in the school, some kids love to sit on the first bench. They might not be knowing anything, but the backbenchers, they might be doing whole noise, but they might be knowing everything. So this is a kind of, downplaying or underplaying. A lot of people will be underplaying despite having the potential, because they won't be able to release that potential due to the self-doubting. So how we overcome all these things, we'll go through steps further. So withholding your thoughts, knowledge, opinions, these all things are imposter syndrome. There is one more thing is very important. Even if the opportunities are knocking your doors, you don't have the confidence of opening them, because you are again suffering from a self-doubt. So somebody comes and tells, would you like to lead this project, Ashok ji? Ashok ji might just say that, I have a lot of regional kind of responsibilities. I don't think I need any more. So Ashok ji is more capable of producing such kind of events or such kind of things. But then one particular thought just made him sit back for a particular moment. Maybe later on he might think, back of his mind, maybe I would have taken that opportunity at that particular moment. So this is one kind of a thing, because opportunity knocks the door once, that's what we say always. And then once it is missed, it's missed. So we really need to see what exactly it is and how we go through this. And that is why this topic is important to understand, and we overcome this topic eventually. So feeling that you don't belong to a particular role, or I'm not good enough to be a mother, I'm not good enough to be a wife, or I'm not good enough to be a doctor. A lot of time happens that somebody comes and tells me, oh, Dr. Varsha, how are you managing the kids? You're managing the school, you're managing 2 kids around there, and you're still doing the exams, and you're clearing the exams, you're doing the presentation. How do you manage that? And then when a lot of people come and ask you that, and that is where the imposter comes back in your mind. Really, I'm doing all these things? Or it is just happening? I am putting efforts to do all these things, but I have started self-doubting it. because this is not going to work because people are asking. So that is where the self-doubting starts coming. So this all comes like an imposter cycle. So let's take with the imposter cycle example. And to get the example with, I'll tell you the cycle is when you start to have a particular task. Suppose you have a project, a task to complete and a deadline in which this needs to be completed. You have got a task and you have got a deadline for it, right? I hope everybody's understanding, right? Because Ashokji, your face is looking like you're just thinking, what is she saying?
Yes, yeah.
So the task has to be complete. So as the task is explained, your mind kicks in with anxiety, self-doubt, and worry. I have never done this before. My skills are nowhere near this level, but all the while you are trying to display it outward that I have this skill, I have the skills. This is all I'm telling how the imposter cycle works. I'm talking about the imposter cycle. Sorry, I would have put my presentation, that would have been much more easier. So the imposter, you get a task. As soon as you got a task, now second step is you have started with an anxiety, right? When you have started with an anxiety, you are then left with that task, with that anxiety, and then you start thinking, oh, maybe overthinking about it. You start doing over preparation for it. And because of that procrastination and overthinking, you are not able to accomplish that particular thing despite having the skills, despite having the knowledge, and despite having deadline way away from the particular task. Because you have got the task today, you have got the deadline, so you know all the pros and cons of particular task when it was given to you. But you are suffering with this syndrome, and because you are suffering with this syndrome, you are not able to put it all together. So that is what happens. And then this happens, the task is not done, you have met the deadline and expectations and have a sense of relief after giving it. But even if you have executed that task, particular task, you are not satisfied within yourself. You are not satisfied within yourself because you are still thinking, I am a fraud. I have not completed this up to the mark. This just happened by luck. So pursuit of fraudulence, increased self-doubt, leading to depression, leading to anxiety, leading to not going into next task and not asking for other tasks despite you have executed it wonderfully and it was too good to be honest, but you are not ready to accept it because you are having that kind of particular syndrome. I'm saying you don't take as you guys personally. I'm talking about a particular XYZ can have a syndrome. So not everybody suffers from it actually speaking, but those who are suffering, then you will see, and this is not genetic disorder. This comes eventually with the environmental factors, with the upbringing, lot of time with the social media. Nowadays, we need to really focus on the social media, Facebook, all these things. These are one of the major factors are coming in the imposter syndrome very much. And the imposter syndrome is highlighted because of these things. Because if we see, most of the people are within their nest. They don't have time to interact with people. They don't have a kind of a human interaction or a human touch. They might just be having the same house and texting to each other from lounge to bedroom, like, are you coming for dinner down? So initially it used to be, we used to shout to our kids, hey, hello, are you coming for dinner? That vocalization used to be there. But now it is all the text vocalization is happening, to be honest. So that is another thing which is very doubting and dissatisfactory for most of the people. So this is what the imposter cycle is all about. So the task assignment, then the preparation, then the task completion, and the reflection. So when the reflection is negative, you need to understand there is something wrong. And this is where you identify yourself, and that is where you did the Klantz imposter cycle. all of you. And
Yes,
majority
no doubt.
of the people, whoever have sent me the clans, the clans
Self-assessment.
questionnaire filled up, they all have, I think hardly one or two of them were not having the imposter syndrome. But out of all of them, I'm not exact, 95%, including me, have got imposter syndrome. So this is what the cycle is about imposter syndrome. So what impact of the imposter syndrome is? So the impact of imposter syndrome is, we have seen how the imposter syndrome can impact us personally and professionally. Personally, it affects because it will affect on your relationships and your home environment. And when it is affecting on your home environment and your relationships, automatically it is going to have an imbalance on your work profession as well. So this is very, very important to understand how the individuals react to it and how we can. So if we go through Shirley Sandberg, anybody knows Shirley Sandberg? She is a Facebook, Shirley Sandberg, she was a Facebook, I think, quite a bit on a Facebook, admitting like having a imposter syndrome, and she had a book, Lean In, and she shared about having imposter syndrome herself, and she wrote a book as well. Then David Bowl, who was, I think, he was working with, I think I'm just not getting, okay, let's go to the personalities, what we know. We know Serena Williams, all of us.
Yeah, yes.
So she also wrote once that there were, even if she was such a great player, she says that in one of her write-up, she said that in her house, she was always comparing herself with her sister. So there were two Venuses. Her sister's name was Venus. So there were two Venuses. And every time her parents used to take them to have dinner or anything outside, she used to get an opportunity to order first. So she used to order some dish, and as soon as the Venus used to give some order, she used to change her order back. Because she used to always have that self-doubt. So these are very famous personalities. Tom Hanks also had an imposter syndrome. He has written in his biography that I always had a self-doubt, and I always used to think that people appreciate me and do all this honor to me. One day they are going to catch me, and they are going to think that I have no ability and I have got this by all luck. So these are all the famous personalities. So we are not alone who are going through all these imposter syndrome, to be honest. So most of the people, as I said, the tech workers and the professionals, these are the people who go through the imposter syndrome and self-doubting. The feeling that you are undeserving, or the current position as a worker you don't have, is always, nevertheless, if you can analyze it, and if you can go through it, and if you can address it, that is where we can overcome this problem. And moreover, I think the way to overcome is having an interaction with human to human interaction, or just picking up a phone call, or just calling a friend and talking about if you're feeling low, or if you have a self-doubt, and get that praise back, or address it, or have, you have the counselors, you need to address it and talk to the counselors and all those things. That is very, very important to be done. So when this kind of things are happening, with the new technology constantly emerging alongside the doubt, continued growth of the tech industry as a whole, it's no wonder many people feel like they are bulking under the pressure of the rapidly developing world of technology, and for newcomers looking to break into the tech industry. So this is what is happening specifically to the people who are working in the tech industries. Healthcare professionals, I did tell, we have so much of competition with different fields and different specialities, and different kind of emerging AI and all those things. So this is very much problematic in healthcare industry as well. So the more experienced I have become, the more I realized that it was within me, but I was not able to analyze it. But then once I started analyzing it, that it is just a part and parcel of life, that is where I could make a differentiation between those two things, that it is just a thought and it is not a kind of thing which I cannot overcome. So once you have that resilience and once you think that you can overcome all those things, that is where one can one can facilitate all these things, to be honest. So the effects are very clear that one can also be have with the healthcare issue. Along with that, then even people with certain racism kind of a thing, or a racial minority, or coming from different background to a different country, and the adjustment disorders, even if they are doing very good at their particular country and now they are not able to execute it at a particular, like suppose, let me give you an example. There are a lot of doctors who do their medicine, post-graduation, everything in India, and now they come to UK. When they come to UK, I have no secondary thought that the doctors are the best. It's not because I come from India, I am telling this, but they are really good at their academics, good at everything. But here what happens is, you come from a different environment, so the environment impact is there, the food habits are different, the working patterns are different, the working techniques are different. Though the basic foundation is very strong, that is why they sustain eventually, but quite a few people undergo imposter syndrome, the well-being gets affected, and then they start self-doubting, and they, instead of being in medicine, they try to go through the different branches of medicine, or they just change their profession, to be honest. So imposter syndrome eventually leads to depression and anxiety. So depression and anxiety are very, very fine line between that. So depression can make it very, very difficult for a people to acknowledge your victories, because you are depressed. So suppose I cleared my exam, and if I'm still not feeling happy, and I am not able to understand what's happening with me, despite the things what I used to enjoy previously, and now I am not able to enjoy it, that is what is depression. While anxiety can lead you to fixate on how others perceive you. So if I'm going to walk, if I'm going to do a presentation, I will be suffering pre-anxiety, or maybe while presenting, I might be in the anxiety mode, because I'm overthinking. So a small goal is, I might be thinking what I know is a drop of ocean, and what people know is the complete ocean. That would be my thinking. But coming to the back point here, actually speaking, we both know equally. I mean, the ocean is of two circles. What you know is one circle, and what world knows is one circle. So there is an equality, frankly speaking. But that imbalance of equality happens because we are overthinking due to the anxiety. So this is what happens in the imposter syndrome. Anxiety, depression, and the health gets affected. So there are quite a few different kind of literatures, but the literature what we read about imposter syndrome in UK, it tells you have 5 kind of imposter syndromes, and those 5 types are perfectionist. They want to have everything perfect. So if you see somebody wants everything spot on perfect, like even a bit of thing they don't like here and there, they are actually suffering from imposter syndrome, and they need to analyze themselves. And there are counseling, there are help out there. There are psychiatrists who can help to overcome this perfectionism. And that has, it's good and bad to have perfectionism, but then you need not compel yourself so much that it is affecting on your day-to-day activities and life. Some people think I'm superhuman. They think about themselves as a superhuman up to the mark that they fall sick or they are not able to cope. So they want to do everything. They try to do everything every minute, and a point comes when they are not able to cope anymore with anything. Even a small change or any small thing cannot. So that is a superhuman kind of a thing. Some people think they are natural genius. So anything and everything, we have certain kind of people. They read one time something and they just remember it. And then parents see that and then they start telling, oh, you are natural genius, natural genius. So that becomes very difficult for them when something new comes and they are not able to cope up, because we all are human beings. There are, of course, exceptions to everything. We all are human beings, and there is a limitations with aging process or with changing environment. We need to accept that we cannot understand or learn everything for everyone. So there are limitations, like I cannot be a doctor at the same time an engineer, at the same time a lawyer, at the same time a computer engineer. So that's why we have a different specialities. But these natural geniuses, they want to have everything and they want to par excel in every field. So that is one. Soloists, they want to be like, just believe that asking for help from others is a sign of incompetence. You want to prove your worth by working independently. So even if it is a huge project, I want to prove that I'm the best. So I'm going to take whole responsibility on me, and I'm going to, I might struggle to do it, but I still want to do it myself. So if you have reached out for help to help or succeed by collaborating, you may feel that overall achievement doesn't count. So these people are not the team players. So these people want everything to be done by them because they think sharing the credit might go to somebody else. There is somebody called as expert, the last one. And the expert, you are hyper focused on knowledge. You feel like you must know everything there is to know before starting on a task. So I call myself a bit like expert, because if I'm going to do something, I'll read everything. I want to know everything beforehand, and every opportunity to know that particular topic or particular thing, I will go and read about it. So seek multiple degrees or excessive certification to ensure you are the most knowledgeable on a specific subject. So I'm not suffering from imposter syndrome, but when I was reading the literature about all these things, that is where I thought maybe I come into this, the expert one. So you fear the situations where you may have to showcase your limited expertise. So you won't participate in particular tasks. I do participate in everything. So that is where I analyze that I don't suffer from this, actually speaking. So this is what the 5 things are, as we discussed, 5 syndromes: perfectionist, superhuman, natural genius, soloist, and the expert. So the symptoms we have already discussed, that if you over prepared, or you might think I'm not actually good at this, I only succeed because I had to put it on extreme amount of work, or you procrastinated, you might believe I'm not actually good at this. Or you can just think that I only succeeded because of the luck. I'm doing this presentation because as I already given an example, because of certain references, I got to get this presentation, not on my ability. So that is again one of the self-doubting thing. So when the next task comes along, the cycle repeats. So this, if the cycle is keep on repeating, that self-doubt, feel like you need to overwork or risk being exposed or incompetent. So these are all the things. You over prepare, you have fear of failure, you might end up on having the risk of burnout also. Nowadays we do, when we were kids we never heard all these things, but nowadays we do hear from kids also, I feel burned out, mom. So these are the new fancy words and they are coming. Of course, we need to really be vigilant and have certain insights about the technology used by the younger generation. And then fear of failure, denial of your abilities, if somebody is not able to accept it, fear of success. So we need to understand all those things about imposter syndrome. So if anybody has any doubt about all this, whatever we have discussed about what is imposter syndrome, what are the effects, what are the types, what are the causes?
There are a lot of questions, Varsha ji, in the chat box. Mr. Dinesh is compiling the questions. So
okay, so then I'll go with how we are going to deal with it, and then we will go through the questions.
Yes, exactly. Yeah.
Yeah. So dealing with imposter syndrome. So how we are, perhaps by now we all have understood that more of the people have got imposter syndrome, right? So having that kind of imposter syndrome, it is very important to analyze with the clans. That is a self-assessment tool, which we have seen. If we keep on doing the self-assessment, we will know, and we will know how to improve about it. So once you have identified your like you are having the imposter syndrome, you can try few new strategies to change your perception. And how do we change this perfection? Suppose if you are a perfectionist, like we discussed about the 5, right? Suppose you are a perfectionist, consider that perfectionism can actually be a roadblock to success. It can make it harder for you to be present, hinder your creativity, and keep you from taking risk and pursuing opportunities because you want to be the perfectionist. It can also affect your relationships with peers, especially if you expect them to live up to impossibly high standards. So if you have set certain standards and you are a perfectionist, you are expecting your peers or colleagues to be at the same scale. That is where the problem comes. So you need to give that kind of openness for accepting that it's okay not to be perfect in every task you do, or it is okay to have 90%. You don't have to always execute. There is always a room for perfection. There is always somebody going to be better than you, how much ever perfectly you execute the job. So that understanding is very, very important. So if you judge yourself on how easily you master a task, then remember to be patient with yourself. Very important. Repetition and persistence are often the paths to improvement. We know that. So if we are, that's why, you know, whenever we take anybody on board, we see the experience of a particular person, because experience teaches a lot. And that experience comes by repeatedly doing the certain tasks. So it might help to reframe challenges as opportunities or experiments rather than hurdles that you need to clear with ease. So that is very, very important. So take up a task or a hobby that you are unfamiliar with. So you maybe you want to learn Japanese language, or you might to just go and learn some piano. Try your hand at a new language, or like I said, or maybe you don't know cooking, just go to the kitchen and start learning something. So there are 2 benefits. As a geriatrician, I can tell you the benefit is your neuronal channelization will be very, very good. So you will not have early dementia. That is one very important thing to go through. And another thing is it will allow you to be comfortable with being a newer, like learning through the repeated failures. So you are not able to learn it, you are able to digest that failure. So learning to cope with that failures is very, very important. And we need to learn to cope with the failure in a positive manner. That's the crux of the thing. So very important. I don't remember, there was a movie of Sushant Singh and Sushant Singh's movie about the college, about the failures, and where his son attempts the suicide. So that is where the kid suffers with the imposter syndrome, because parents were always at the, at a particular scale in their life. So the kid tries to match with the parents' caliber, and that while the whole journey, the parents were telling only about their success. They were not sharing the failures with the kids. And that is where the kids end up into doing a suicide, has an attempt of suicide. So this is very well explained in that movie. If I get a name while discussing, I'll share with all of you.
Chichore.
Sorry?
Chichore.
Chichore, exactly. That's the movie. It's a very wonderful movie, and I think it does describe about very well about imposter syndrome and self-doubt. And I would really urge people to have watch that movie. Then if you believe you need to know everything before starting a task, keep in mind that the quest for knowledge is actually unending pursuit. You cannot end it. There is always, and due to technology, if you put imposter syndrome, one word in Google, I think whatever I'm talking would be in vain. You might get much more better things to go through and understand through. But sharing and discussing it is utmost important when it comes to sharing the knowledge, and to believe that. So it's very, very important to keep in that mind that knowledge is actually unending pursuit. So recognizing our limits and having that insights about ourselves is very important. So acknowledge that you don't need to know everything to start a task. Even if you have a little knowledge about it, and if you start the journey, then only you are going to reach somewhere. You are not going to reach somewhere just by collecting so much of baggage, and you are not going to be able to move on the next step because you have so much of baggage. By then, everything would have already changed in that particular research or particular job. Or maybe you want to execute some coding task, or you are going to just execute some device, but you are just looking to make it more and more perfect. By then, maybe somebody already have the similar idea and executed it. So try to be stupid sometimes. It's nice to be stupid sometimes as well. So practice relying on others' information. Start with a goal of asking 1 or 2 questions every day. Ask yourself as well. Feeling uncertain about a professor instructions, you are not sure about certain things. So asking a mentor or having a mentor in life is very, very important. Especially those who are going through. Why imposter syndrome? In general, also, I think everybody should have a mentor, because a mentor, what is a mentor? Everybody has a different definition of mentor. So what exactly mentor means is the mentor understands you at your ability, and he or she tries to guide you in a right direction to achieve your own goals within your limits, and makes you realize where your limitations are and where you can exceed. So it's very, very important for all the people. So if you hesitate to ask assistance, that is again a problem. Do not hesitate to ask help. So if you are at a difficult position, trust me, in today's era, if you put one text message on Facebook, even if your friends and family might not come to help you, if you type on Facebook and tell, I need a help, this is my number, can somebody call and talk to me? You will get n number of friends, n number of people talking on phone. Nowadays, people don't have within family enough time to talk within themselves, but they do have time. Some people do have time to talk to other people and really make a change. So do not keep within yourself. Have that realization. It's very, very important. So do not hesitate to ask assistance to overcome imposter syndrome. So analyze what point is there. Maybe a lot of time your boss is talking to you in a particular way, or particular thing, if you don't like the way he talks to you and you are not confident enough to go and say it to him on his face, try to ask your another colleague or somebody that this is putting me down, this is taking me back step all the time. What is the solution to do this? How can we do? Don't go and fight with the bosses. I'm not giving you that advice. But yes, there are ways of dealing with it. And that is called as how you word it out. The voice impact, the way you are putting the words. Hey, go and get a glass of water. Or please, can I have a glass of water? These two sentences are same, but the voice pitch and the way you're going to say to a particular person is going to make the difference. So do not hesitate to ask for the help. Maybe your colleagues, somebody will be able to help you. So if you believe you need to do it all yourself, that's not right way again. Consider the benefits of narrowing your focus. If you think that, yeah, this has to be executed by me and me, then you need to drop down all your other 10 tasks and focus only on that one particular task. And that is when knowing when and how to delegate. So other tasks you will end up into delegating. So that is time management. In time management, there are 4 things, and then you have to have those 4 compartments. And in those 4 compartments, you need to understand what is useful, what is very, very useful, and what is not useful. So that time cycle, we all need to have that time cycle in the 4 compartments, and which is not very important, and what is important, what needs to be done today and now is the 4 things. And that 3rd compartment, you need to start delegating to other people. So very important. So challenge yourself to decline or delegate to work is very important. So especially with a lot of us, we have a kind of thinking that no, if I delegate this work, they might think I'm incapacitated or I'm not capable enough to execute this task. So this is really not right thinking. It is appreciating yourself that yes, this is my limitation, but whatever I do, I'm executing the best at my capacity. So if you are executing that best at your capacity, it is still worth it, because both the task which you have delegated to your colleague and the task you are doing, if you come back together, the outcome is more higher. And always appreciate. Appreciation is one of the key to the success. Appreciation is very, very important. Appreciate your colleagues. Have gratitude. If you have the gratitude towards your colleagues or your family members or anybody, nothing like that, the happiness and the contentness you get and a peace of mind you get is enormous with having that in, to be honest. So these are the certain things how you overcome, practice, talk politely and execute it. In if you are in the thought process that you are not able to understand how to execute or how to deal with a particular problem, please understand that there is a help available. There are therapists, there are counselors, there are doctors. If not, pick up a random person's phone number or just drop a text on the Facebook. You will get people who will just listen to you. They don't know you. And because they don't know you, they are not going to judge you. They are just listening to you. That is another way of just venting you out. Venting out is very important. In today's era, people don't have time for each other. I'm talking within the compact zone of the human being, but on a wider, so there are pros and cons of everything. Because of the technology, though we are in the compact zone, another part of the technology is still we can go and have a lot of help from others as well. So there are a lot of backstories to look into and do this thing. So cutting back on the social media, if you are a lot on social media, please try to cut down. Cut down in what sense? If you are putting certain things and waiting for validation for the whole world to you, then you need to understand that that validation doesn't make sense and you need to cut down and just disable the notifications, or if possible, set aside specific times of the day to use the technology. or put it in a sleep mode and have a peaceful sleep in the night. Very important. Dedicated more time to offline interaction and hobbies is very, very, very important. So I have recently, my kids have just finished the school and they are home. So we have just started one thing, reformation from this holiday, that all the technology things, we have double-story house. So all mobiles, computers, laptops, everything, every single thing, including tabs, everything, we keep down in front of the TV, and then we come to sleep up on our bedrooms. So nobody carries their mobile in the room. So there are two benefits of this. One is, even if you get up in the middle of the night, your mobile is not next to you, you are not going to touch it. And still, if you have urge of having and you have that much dedication, at least you are walking back to your mobile. So when you go back down and you're sitting there, when you're coming back, you might again put the mobile back there and come and sleep. So that way you're going to have a personal time for yourself. It is very important to have the interactions, at least have one family meal in the evening or afternoon together without handsets. I had came across few restaurants. They just give a good benefit, like good discount if you put everybody puts their mobiles away and they eat together. The family eats together. So these are certain things to overcome imposter syndrome you can go through. So so we have a lot of questions. Ashok
Yeah,
ji,
we have assigned Mr. Dinesh Kumar is our chair for our HSC communications and leadership. So he will lead the Q&A session, madam. So you can just answer those questions. Yeah, Mr. Dinesh. Yeah.
Thank you very much, sir. Before I start the questionnaire session, I would like to request to the already presenter spotlighted, spotlight yourself also, Ashok Sarji, as well as to me. And when any person appear to ask the question, you can, if you can, spotlight to him also. First of all, thank you very much.
Yes. Yeah. Go ahead. Yeah.
Okay. First of all, thank you very much, Dr. Varsha, for your presentation, which I believe was very informative and as well as very understanding to everyone, because it was the same flavor of your speaking with presenters and the audience. Imposter syndrome. Really, I no hesitate to say that I heard the first time this. I heard the first time this, but I have it. So what I could understand from your presentation, I can say what is the imposter syndrome for me. If I say, I believe that everyone knows more than you. Think that others believe you are more skilled than you really are. Or I can say, Ashok sir knows more, expecting that I know more, but I really doesn't know that part. So these are the I can understand from your presentation, and better dismiss your success and credit to the luck. These are also are the one of the imposter. So let us move to the question. Just a second for me. First question is from the Ashok Sarji. This is we have the safety trainer, and we do the in our HSC profession safety training. So how can we identify that imposter syndrome amongst the workers, and how do we overcome? This is the first question from our trustee, J&A Global, Mr. Ashok Karlapati. Please, Dr. Saab.
So for the industrial workers, I think all the industries, it's very mandatory. I have done affiliated fellowship in industrial health. So I know all the industries who have more than 250 workers need one medical officer in the industry. Am I right?
Yes.
So every industrial health worker, doctor should have the clan scale while you're putting particular person on the job. That is one way of doing it. But now you have maybe the person has given all right answers and you can't identify. Now the challenge is there. He is already at the workplace and you need to identify whether he is ability. So when the person has came and if his ability was, he was working, so I'll just give you an example of a product, okay? So he was able to produce 10 products when he came to the industry. Now he is able to give you only 5 products. And after that, he is able to give you only 3 products. So there is somewhere, some gap is there, right? From 10 to 5 to 3, it's a huge gap. It means some link is missing. Either he is not getting the appreciation, either he is dejected, either he did not get enough of the knowledge, which he is not confident enough to show it to you that he didn't have that knowledge. So this is how you can analyze if the performance scale is one of the things where you can analyze, right? If the person's capacity. Second thing is the person was very cheerful and now he is not able to be that cheerful and not able to take any tasks within their hands. That is one of the things where the person is suffering from imposter syndrome and self-doubt. Maybe he was very good at previous job. He was very comfortable, or in the new environment, it is taking time for him to fit. So to overcome this, we call it as one-to-one discussion. So it is very, very important you have one-to-one discussion with the workers. So now it is not possible for a supervisor to do that. So what we do is we have 5 workers and we have 1/6 worker as a leader for them. So you have 6 people in one group. So one particular person, for those 5 people to understand what are their problems, he can understand it. He can correlate that problems. So if there are 50 people, you have got 5 leaders. Out of that 5 leaders, one can come to the supervisor and discuss all the problems. So this is how you can overcome the problems and analyze why he has got that particular. Now, if he has got a psychological or health issues, definitely you need to address that by taking the healthcare professional or a counselor's help.
Thank you.
Thank you very much.
That made sense.
Certainly that helps. Yeah. Please go ahead. Yeah.
I hope, Ashokji, your question is answered. So let me move forward. The second question is, what if the person needs to win conversations and feels bad if not happens? Question little bit not clear to me. What if the person needs to win conversation and feels bad if not happens?
So somebody wants to win the conversation.
Yes.
Actually, I'm not able to understand the question. I'm
I
sorry.
will chat in the public, so you will be able to see what. Otherwise, I will bring the person who made the question. It is in the public chat. You can see. It is difficult to me also understand what you want to ask.
Yeah, let's go to the next question. Then we can ask that person to ask himself.
Thank you very much.
Yeah.
Next question is what obstacles exist in identifying the imposter syndrome? Dr. Varsha?
Obstacles about imposter syndrome is self-analyzing, because people don't analyzing they are suffering from imposter syndrome. So the awareness and understanding that they have self-doubt and that is why they are not able to take the task is very important. So that is where the key comes of awareness and education, because people don't, there is very fine line between depression, anxiety, and imposter syndrome, perfectionism. So they all overlap with each other. So analysis is very important, because if you are not able to do, as I said to you, people who are very perfectionism, that people are suffering. They don't understand. They think unless somebody comes and tells you, you don't realize it. Like now I have made, like one of you told me that they did not realize till we spoke about it that the particular person was suffering with imposter syndrome. So it is very important for us to create that awareness. This is imposter syndrome. It is not your inability to execute the task. You have the ability, but because you have a self-doubt and that imposter syndrome, that is why you are not able to overcome. So how do we overcome it? By talking to people, by telling, like the conversation and appreciation. So this is very, very important. That gap bridging is only possible by talking. I hope I'm making sense, because unless you are not going to talk, you are not you're not going to be able to execute it, right? Because you need to understand that you have got it, and it is only possible because your performance is not good because of, like, you give some task to them when they are on their own. Let me give you an example. Like, you gave them a task of talking something, and they have done the talk very good in front of you. Now you gave the same task to the particular person to talk in front of 10 people, and that person is not able to execute that task. He is not able to execute that task, not because he is not having that knowledge. He is not able to do that because he has got imposter syndrome, because he is self-doubting himself.
Thank you very much.
I hope I'm making sense, or it doesn't.
Very perfect, very perfect. It is going on very perfect. Mr. Lakshmi Naranji, I will acknowledge you. Let me finish previous question. Next question is that I am also posting in the chat, so you will see. If imposter syndrome is not genetic, can it be overcome by counseling and psychomedical experts trained for it?
Yes, that is very important. That's the key is that you need to have counseling, you need to have constant support, and you need to talk constantly with people. That is very important. Why this imposter syndrome is more and more highlighting, and more self-doubt is coming? Because we a lot on social media, we are comparing ourselves to a very, very high standards all time. Before few decades back, when we were not exposed to the social media, we were not having that global exposure continuously, and we were not measuring ourselves to that thing, that particular standards. We are ourselves increasing our standards, and we are having that self-doubt because of that. So only this is possible to have certain kind of a counseling or a help, or having that appreciation and accepting that, yes, I am good, I need to improve, but I am good at what I am. So unless I am going to backpat myself, yes, Varsha, you have done the best presentation, I'm not going, even if 100 people are going to tell me you have done the best, unless it is not going to come within myself, it's not going to work. And the counselor's work is that when the cognitive behavioral therapy, or we call it as CBT, and then we have certain kind of counselings where wellness coachings, these all coachings help a particular person to overcome these kind of the issues. And yes, psychiatrists and counselors play a very key role here. So definitely I would suggest this is one of the method of overcoming that professionally. And yes, it is not genetic. It comes with lot, to be honest, with, or maybe in near future, it might be very early for me to say that it is not at all genetic. It might be genetic as well. As I said, there are personality traits which cause certain things. So maybe this is one of the near future research which comes, the imposter syndrome has the genetic contribution or on the molecular biology scale. So I don't want to comment on it that it's not genetic, to be honest. It might be somewhere genetically related as well.
Thank you very much. Next, I will bring to Lakshmi Naranji on the screen. You can ask your question because it is not with me. You were raising hand, please.
Yeah, thank you, Dinesh. Thank you, Dr. Varsha. This is Dr. Lakshmi Narayan.
Yes, sir.
It's a very interesting discussion. The day it was announced on the OKT WhatsApp group that there's going to be a talk on this imposter syndrome,
yes, sir,
I was a bit intrigued. So what I did was I started exploring it on an AI tool called Meta.
yeah.
Okay. So I got a lot of information on that.
Yeah.
And a very interesting fact that has come out from that is that Albert Einstein was one of the persons, leading personalities who was afflicted with that.
Yes.
I'm sure you know that.
Yes.
There were some other people, of course, Tom Hanks also, as you mentioned. Then, of course, this lady by name Michelle Obama,
Yeah.
she also too had this affliction.
Yes.
More importantly, my observation is actually, see, there has been one particular Hindi film where a song had to be recorded. And this film was particularly of always early 60s or 70s, maybe around the time when you were a kid, possibly. Okay. Now, this particular song had to be sung, and the music director approached the singer Mohammed Rafi. I'm sure you must be knowing Mohammed Rafi, the singer.
Yes, yes.
Yeah. So he approached the singer Mohammed Rafi.
Sorry.
Yeah, that's okay. So he approached him. So Mohammed Rafi, after listening to him, he said, I think Kishore Kumar would sing better. Why don't you approach him, he said. Okay, then he said, then the music director approached Kishore Kumar. Then Kishore Kumar also said the same thing. No, this particular song, I think Mohammed Rafi would sing better. So both of them said this way. So it's not, I don't really think this is a question of him being an imposter or something, but I feel it's a question of being their modesty, or maybe something like they are trying to acknowledge the others' virtues as well. What do you have to comment on that?
So if I may say, I just mentioned about gratitude and appreciation and the respect. I would say the respect towards your colleagues. It's very, very important. Appreciate your colleagues. So a lot of time, what happens, I work in geriatric medicine. So a lot of time, I'm just giving you an example about what I do as a geriatrician. So when I go in the geriatric ward, and if because I come from India and then I started practicing here, there would be a difficult conversation with the elderly people. And a lot of time, their accent or something, I might not be able to understand. But a social worker who is on the wards, who is looking after the elderly patients, she goes and talks to the elderly person. She is very open and very happening person to talk with her, with the social worker. But then what happens when I go, she's not happy to talk with me, but she's happy to talk with the social worker. At the end of the day, here, what's my end thing is to treat the patient, but I'm not able to do it because of the communication. I'm not able to do that communication, but the social worker is able to do it. So when my consultant comes, now I am a consultant, but when I wasn't. So my consultant comes, I always used to say that I haven't done anything. This is all Jane has done, because Jane was able to communicate with the patient much better way, and she communicated to me and I could understand it in a much elaborative and a better way. So what happened eventually, all my ward colleagues, my nursing staff, more than the consultant, these people used to be more friendly with me and more loving to me, because that appreciation and acknowledgement is very, very important. So I'm sure this is what Mohammed Rafi and Kishore Kumar had. And my dad's, he's no more, but his batchmates from 1965 batch from Aurangabad Medical College, all the doctors, I know them personally because I organize their get-together. Whenever I meet all of them, I see the warmth, the love, the gratitude, the appreciation they have for each other as colleagues, as a friend, is enormous, I don't see that in our generation, to be honest. I'm 45. I don't see that in my generation, that appreciation and the gratitude towards the colleagues. A kind of a competition which has set back all of us. And that is why imposter syndrome has came like a very highlighting point, because all of people are self-doubting and comparing. Here, Kishore Kumar and Rafida, they did not compare each other. They were just trying to give the opportunity to each other. So this wasn't the imposter syndrome as per my acknowledgement, as well as what you said. Definitely. It wasn't.
Exactly. Even I was under the same thinking. I had the similar thinking that it was not really an imposter syndrome, but they were acknowledging each other's skills and competencies.
Yes. So it wasn't a
Thank you so much.
self-doubt, definitely.
I
Thank
think
you
it
so
was
much
a
for your
delightful
elaborate
discussion.
Dinesh ji, there is a good question from Mr. Parda. Please read out that one.
Sure. Doctor, there is a question. It is a bit long. Are you aware of any organization that regard imposter syndrome as a critical aspect of human resources management and have processed and system placed to address it? Why are the fundamental elements to consider for incorporation in the system? If it is very long, I request to all questions who are asking, please make it the compact and to the point. So it will be easy to understand to the presenter. Shall I chat again, Dr. Varsha?
No. I understood the question. The crux of the question was, are there any organizations which are working on this, or there is any kind of help available? So there are certain organizations, there is list of organization. I'll share it on the screen. As I said, my PPT, I just last minute rushed from the hospital. My PPT is not handy. I had all the resources, articles, everything. I'll just post it to Ashokji and he can post it to everybody. Or if you guys want I can share my entire PowerPoint presentation. By tomorrow afternoon, I'll share it with Ashokji and he can share it with everybody. So definitely there are organizations. If you go through, I'll just tell you.
Dr. Varsha ji, you can share that, but let me elaborate on this question.
Yeah.
The question is related to companies having a HR management different skills. They evaluate the people. Is there any criteria on the imposter syndrome? That's the question.
The Glance scale is there where you can analyze, and this was self-assessment scale what I have shared with you. But for the assessment, there are 20 questions assessment scale for doctors.
No. His question is, does any organization is having a criteria for their employees to evaluate imposter syndrome, something like that?
I don't think they analyze directly it as an imposter syndrome, because you cannot highlight diseases like that,
Correct,
especially with mental health and well-being. So there will be a question, are you having self-doubt about yourself? I think there are certain things, and there will be a particular question, do you need any kind of help to do this particular task?
Something like that, yes.
So these kind of questions are there, but I am not very sure, because I think every institute and every HR department has a different evaluation scales depending upon the task to be executed at that particular institute or that particular industry. So skills and evaluation will be different, because at medical fraternity it will be different. If it is industrial, where there is a lot of labor work, I'm sure it would be a different scale to analyze the people on the physical ground rather than the mental ground.
Thank you, Dinesh ji, for conducting the questions. If you have any more questions, we can keep for one or two, but we are running out of the time.
So there is one Imposter Syndrome Institute.
Okay.
So the name of the website is also impostersyndrome.com. So you will get all the information about it and everything. So it's quite a nice thing. You'll get better knowledge than whatever I tried to explain. I'm extremely apologetic for not having my PowerPoint presentation, but I did not wanted to let you guys down also because of the PowerPoint. So I've tried my best to do.
Hopefully, no. It was very interactive and it's very good session. We had it. Of course, you can always share the information because it's being recorded, and we'll share the recorded session along with your presentation, so it will be easy for them. So thank you, Mr. Dinesh, for conducting the Q&A proceedings. We would like to continue with our recognition. Mr. Jitu, it's a time.
Give me a second, sir.
Yeah.
Give me a second before you proceed.
Sure. Yeah.
Since I can see there is no raised hand, so there is no question. I would conclude my QA session with the thanks to the who came forward, asked the question, and most importantly, Dr. Varsha, who very well clarified.
Very
At
nice.
last moment, I will ask one question while you the chance. Dr. Varsha, how do we know that I or we have the imposter syndrome?
It is only possible, as I said, if you have a self-doubt. It's very simple. If you have a self-doubt about yourself, then you are having imposter. But it is not, some people carry it throughout the life. When I started my presentation, I told some people start it, some people have it as a transit. It just comes and goes. Some people carry it and then they don't evaluate, they don't take the opportunities at all. So this is how you can analyze actually. If you are, I mean, not you or any XYZ person is not able to take the opportunities coming and self-doubting continuously, then definitely the person is suffering from self-doubt. And self-doubt is imposter syndrome.
Thank you very much. Give a round of applause for Dr. Varsha. And over to you, Ashok sir.
Thank you. Thank you, Mr. Dinesh, and appreciate your Q&A process. And Mr. Jitu, it's a time for recognition to our speaker of the day. Please go ahead.
Thank you, Ashok ji. All I have to say is what a wonderful, I can say, outstanding presentation by Dr. Varsha ji that generated this. Another word, there is remarkable discussion that generated by the presentation, and especially Dr. Lakshmi Narayan's example of Kishore Kumar and Muhammad Rabi takes me to my senior center. And I have the same challenges that we have 35 singers and each one, and then sometimes the audience they say, Jitu bhai, you don't give that person opportunity in this. But in my theory, and I fully endorse and agree wholeheartedly, Dr. Varsha ji, that the gratitude, appreciation, and motivation is the key for success. And in that, there was one singer, many people told me, don't give that person opportunity again. That person is now nationwide, is invited to sing. So you can imagine that motivation, appreciation, and everyone is a winner approach can do so many good things. Thank you, Varsha ji. Outstanding presentation. We loved it. And we really appreciated what you have done for our foundations. And for that, this is the list we can do for you that amongst all the J&A, both foundations, we extend this gratitude to you by just giving you this certificate with thank you to you. And with that, this officially you will be sent by email this e-certificate to you. Hand over to you, Ashok ji, for some announcement that we have to make.
Thank you, Jit Saab, and thank you, Dr. Varsha ji. And we have 5 minutes more of announcements and before we conclude the program. And yeah, this is a fourth program, as I was telling, that announcement of Dr. Praveen and Patel and Ms. Mita Patel Scholarship Program. We are announcing today, date of announcement is 24th July, and last date of receipt of application forms is 15th September, and review by the J&A committee. We have the two facilitators, Dr. Professor Ramana, as well as Dr. Lakshmi Narayan Pradhaturi, who are also on the call, and we'll be announcing the winners on 31st October. And we can take a screenshot of this particular thing. We'll also post this in our WhatsApp group as well, so you can share with deserving candidates about this particular program. So before we move to, we just want to have one word from the Professor Ramana as well as Lakshmi Narayan. Would you like to have a few words about this scholarship program, sir? Maybe
yeah, Mr. Ramana. Mr. Ramana, would you like to say something?
Yeah. Right. Am I audible to all of you?
Yes, Ramanaji,
Yeah. Very good evening. Thank you all. This particular, I have been holding this position given to us by the founders, both Mr. Jitu Bhai and Ashok. to be a chair for the students mentoring and scholarship. No, though this job is not new to me, I have been working for one of the good institutes in India, National Institute of Construction Management, where I used to administer similar scholarships, and this was a job that is entrusted to me, which I am carrying it out. In the last 2 batches, we have given scholarships. Now I'm very glad to know that both Dr. Patel and Mita Patel have sponsored this scholarship for medical education, purely medical education like preventive medicine health related, though we were only concentrating on health and safety. That is one thing. Second thing is I have my very good friend, Mr. Dr. Lakshminarayana, who is highly dedicated, and I have entrusted him to identify the medical schools and which are conducting government recognized programs so that we can select appropriate students as per the criteria laid down, and we will try to see that we can provide them the names from our side, selecting from the medical institutes, so that this scholarship can also be I mean, it is already launched, so we should be able to get this scholarship completed as per the deadlines specified in the schedule. So this is all about from my side, and now I request Dr. Lakshminarayanan to have a few words. Thank you very much.
Yeah,
Thank you, sir.
thank you, Mr. Ramana. There isn't much to tell after what you have already elaborated. So what I have to say is I thank the founding trustees Ashok Garbapati Garu and Jitubai Patel for making me facilitator for this particular program. So having become a facilitator for this for the first time, I was a bit new to the technicalities of this particular thing. But whatever it is, with the little briefing that I got from Professor Ramana, I approached the principal of the Osmania Medical College and the HOD of the department which caters to health, safety, and environment. So I just made a beginning, and I'm likely to get some nominations from that college, maybe in a couple of days from now. And once we start that, maybe I'll be approaching some other colleges which are into that health, safety, and environment courses. So I'm hopeful that I'll be getting some nominations from some of these institutes. I really hope that we make some headway in this.
Excellent,
thank you, Ashok Garu, and thank you, Jitubai.
Thank you so much. And I'm sure this particular program is in safe hands now. So we are officially announcing from today, and we have the calendar of events also be announced. So we'd like to continue with the proceedings. Yeah, these are the scholarship details which we'll be honoring 4 students worth of 20,000 rupees each per year. And the criteria is there in our website as well. So we just would like to thank our financial donors as well, which you can see on the screen. And this is for the Global Foundation donors. And we have a knowledge donors. And today, Dr. Varsha is going to be on this, what you call that Hall of Fame, something like that. So these are our knowledge donors. And we have a knowledge ambassadors of the WhatsApp group as well. There are so many people have been supporting our knowledge group 24 hours a day. And these are all our functional committee members and other things. So we do have a memorandum of understanding. As I was telling, that we collaborate with so many organizations, and we have a MOU with the Invo Systems. Next 21st August, we have a OKT session from Invo Systems Singapore, and we have a Center for HSC. Mr. Ramprasad has been supporting us. This is an MOU with the HSC CHAMP, and there is a global quiz also goes on every now and then. And our upcoming OKT session is track your carbon footprint to adopt sustainability practices, save cost, and contribute to the nation's net zero goals. Even in yesterday's finance budget, a carbon trading system is being introduced in India, from this month, this year onwards. So it's a high time to learn and understand what is these things about the net zero goals. And with that, we would like to listen from our Jitu Bhai as well as vote of thanks. These are our foundation account details. You are welcome to contribute to our foundation. And these are the global foundation details. And this is our QR code for the flip book, what activities we have been doing from last 2 years. And with that, we would like to have our vote of thanks from Mr. Asia, is the chair for Finance Administration and Foundation Promotion of our both foundations. Mr. Yash.
Hello, hi. Can you hear me?
Yes, we can hear you. Yeah.
Yeah. All right, perfect. Good evening, everyone. It gives me an immense pleasure to extend this heartfelt vote of thanks on behalf of the organizing committee for the 30th OKT webinar on Imposter Syndrome. Do I have it? Its impact on workplace safety. Today's insightful session was led by the distinguished Dr. Varsha, whose expertise and eloquent presentation undoubtedly left us a lasting impression. And without the help of using a PowerPoint, it's actually a big task to do it, and it's a very difficult task. Dr. Varsha, your in-depth analysis and practical insights into the nuances of imposter syndrome and its implications on workplace safety have been enlightening. We are truly grateful for your time, taking time of your busy day after post-work hours, and investing in sharing your knowledge with us today. I would like our deepest gratitude to the founders, Mr. Yutu and Mr. Ashok, whose leadership and commitment to promoting HSC initiatives have made events like this possible. To the audience who have joined us today and stood with us till the end of this event, thank you for your active participation and for making this webinar a success. Without your enthusiasm and engagement, we won't be able to have these impactful sessions. Once again, thank you for being a part of this webinar. We look forward to many more enlightening webinars in the future and hope you join us again in the next OKT session. Thank you.
Thank you, Yash. And it's a time for us to conclude the session with any further remarks from Mr. Jitu, and otherwise we hereby conclude our session. Mr. Jitu.
Last remark is, Ashok ji, as always, you've done a fantastic job of handling the session. Such a wonderful session it was. And thank you all very much, and be safe wherever you are. Thank you.
And we request you to open your cameras so that we can have a good, screenshot for our records. Yep. Let me stop.